There is one important factor which normally not get into detail when we are deciding our diet or by the nutrition experts or doctors. That is BMR, basal metabolic rate. Now, what is basal metabolic rate? Basal metabolic rate is the minimum amount of energy required by the body to maintain life at a complete physical and mental rest in post-absorption state. Several functions within the body occurs during this basal metabolic rate conditions, that is your working of your heart and coordinations with different organ, GI mobility and transportation across the membrane. Now, BMR, in different the BMR calculations, there is a medical or clinical process. What is your BMR? Because on the basis actually how much calorie diet to be given, that is decided. There is a resting metabolic rate or RMR, and there is a exercise metabolic rate. So when you are doing exercise, how much calorie you need. So there are two actually category depending on those who are a sports person, they need to calculate on that basis actually. And whenever we take energy in terms of food, actually there are distribution of consumption of this energy, like say by BMR it consumes 75 to 65%. By physical activity we can consume it is 10 to 30%, or by thermic effect it goes maximum by 10%. Though there are a lot of calculations of BMI for your age, your body weight and all these things. I'm not getting into those detail, but there is a factor call actually, like whenever you talk about your food, then doctor decide what do you do. So depending on your physical activity in your day-to-day life, there is a factor multiplying on the BMR. Say your BMR is say 1500 calorie, so little or no exercise people, then your total calorie requirement would be 1.2 into BMR. Similarly, those who are medium exercise, 1.5 into BMR. Those who are high exercise, that is 1.7 into your BMR. There are five main factors on which affects the BMR actually, like surface area of your body directly proportional to the body surface area. So those who are very slim, their BMR would be a lot less. Sex, like male or female, it is seen that male has normally 5% more BMR than the female. Ages, like in infant or growing child, BMR rate is much higher. In adults, BMR rate decreases at 2% with every decades actually. For in 10 years, 2% BMR got decreases. Physical activity, there are a lot of hormonal factors also. So 10 main factors which on which basal metabolic rate depends, that whether you are a male or a female, whether you have more muscle or less muscle, whether younger by age or older, whether you are pregnant, whether you have fever, whether you are tall or thin, whether your thyroid is very active, whether you are a smoker, whether you are doing physical exercise very much actually. So we need to know before get into the diet sets and all these things. Thank you so much.